Welcome to a video on culturally competent approaches to childhood anxiety disorders. Anxiety is the most common mental health concern affecting children and adolescents. Left untreated, anxiety can lead to a number of negative outcomes. Therefore, it is essential that we understand its development and use evidence-based approaches to prevention and intervention. Today, I'm going to talk about culturally competent approaches to understanding both the development and treatment of childhood anxiety disorders. Anxiety comes from both genetic and environmental influences. Some children are born predisposed to anxiety through temperament. Temperament is the biologically based predisposition to respond to the environment in particular ways. It is at least partly heritable, and there is debate about whether temperament itself can be altered by the environment, or if the environment may influence how or the extent to which it is displayed. Behavioral inhibition, or fearful temperament, is the disposition to respond to new or uncertain situations, objects, or people with wariness, hesitance, and withdrawal. Behaviorally inhibited infants and toddlers stay in close proximity to their caregivers, are shy with other children and adults, and are easily distressed in new situations. Behaviorally inhibited children may remain shy and avoidant into later childhood and adolescence. Behavioral inhibition is the strongest predictor of childhood anxiety disorders. Of course, not all behaviorally inhibited children grow up to develop anxiety, and this is where the environment plays an important role. Inhibited children seem particularly prone to developing anxiety when their environments prevent them from developing a sense of control over their worlds. This may be because their parents exhibit overprotection or intrusiveness, or because of more extreme environmental conditions, such as loss or trauma. In terms of parenting, it is important to consider that inhibited and anxious children may elicit overprotection or give cues that prompt parents to be over-controlling or intrusive. So bidirectional influences within families should be acknowledged. This temperament-based model of anxiety development comes largely from research conducted in North America and Western Europe. Western parents report valuing characteristics of independence and sociability, and report finding inhibition and shyness to be less acceptable and less desirable. They report becoming distressed by children's displays of inhibition and shyness, or seeing their children as vulnerable and in need of protection. Distress and perceptions of vulnerability may then be what leads them to act in an overprotective or over-controlling manner. Of course, there are individual differences in these parenting beliefs, so Western parents who report being most distressed by their children's lack of independence may be most likely to engage in overprotective or over-controlling parenting. Peers similarly find shyness and inhibition less acceptable and act negatively towards inhibited children. In other cultures, people have different shared beliefs, values, and customs that influence both behavioral displays of temperament as well as parent socialization of behavioral inhibition. For example, traditional Chinese culture stresses interpersonal harmony and social order. Chinese parents report viewing behavioral inhibition as more acceptable because it is interpreted as deferential to others. Peers do not reject inhibited children. Perhaps because of their general acceptance by both parents and peers, behavioral inhibition is more common but less predictive of anxiety and other negative outcomes in China as compared to in North America and Western Europe. More recent research suggests that in urban Chinese cities, behavioral inhibition shows a similar relation to anxiety as in Western cultures. Thus, it is important to consider both the effects of urbanization and the time periods during which the research was conducted. There are considerable differences in behavioral inhibition and parenting beliefs across and within Asian countries. Unlike in the Chinese samples, parents from South Korea reported responding to behavioral inhibition with protection and lower encouragement of independence. Similarly to both North American and Italian samples, parents in India found their children's shyness to be less acceptable and reported responding with controlling parenting behavior. Therefore, it is important to examine culture very specifically, rather than making broad generalizations for particular regions of the world. Further, in all of these samples, there were significant individual differences, suggesting that other environmental factors play a role in determining how parents respond to behavioral inhibition and how inhibited children develop. Overall, considering both the normativeness of behavioral inhibition and its fit or lack of fit with cultural values may determine whether it is a vulnerability for later anxiety disorders. Once anxiety does reach clinically significant levels, the empirical literature suggests that the approach that has garnered the most support is cognitive behavioral treatment, or CBT. The cognitive aspect of treatment focuses on children learning to challenge anxious thoughts with more realistic thoughts about the outcome of a situation and their abilities to handle that situation. This strategy is called cognitive restructuring. Additionally, children may learn to engage in positive self-talk or statements to themselves reinforcing their coping abilities. The behavioral aspect of treatment involves exposure to situations that induce anxiety in a systematic fashion. This gives children practice coping with anxiety. Exposure is a part of CBT, but may also be used by itself without the cognitive component. CBT may also include psychoeducation about anxiety, the teaching of relaxation techniques, and problem-solving skills training. CBT and exposure-based treatments have been found to be the most effective treatments for children across a number of ethnicities and in a number of countries, including the United States, Canada, the Netherlands, Australia, China, and India, among others. Treatments that do not contain exposure techniques have been studied across less diverse samples. Even though it may be the most effective approach across a number of cultures, there are cultural factors that determine how effective CBT is. For example, in Latino families in the United States, the extent to which parents were acculturated to mainstream culture determined whether group-based treatment with peers or parent-involved individual CBT was most effective. When parents had low acculturation, parent-involved CBT was most effective. When parents had high acculturation, peer group-based CBT was most effective. One cultural adaptation of CBT is cultural storytelling, developed for Hispanic youth living in urban areas of the United States. This intervention is delivered in a group format. The adaptation presents images of Hispanic youth dealing with situations at home, in school, and in the neighborhood, and incorporates elements of Hispanic culture. Children work together to come up with a story relating to the picture and relate it to their own lives. The therapist responds by encouraging children's use of adaptive coping and move children away from maladaptive anxiety-based responses. The children then dramatize the story on videotape. This approach has been shown to result in significant reductions in anxiety compared to passive video watching. Another cultural adaptation of CBT involved including culturally relevant content for children of North American Indian or First Nations backgrounds. In this case, the inclusion of culturally relevant content did not change the effectiveness of treatment. Everyone showed reductions in symptoms. Given what we know about the development of anxiety, it will be important to broaden the understanding of the role of culture in anxiety treatment. Given that parents may be incorporated into CBT, therapists need to consider parents' beliefs about shyness and anxiety and the culturally appropriate socialization of these behaviors. Suggesting changes to parenting behaviors relevant to only particular cultures may be invalidating, disrespectful, or unhelpful to families with other cultural identities. Therefore, therapists should consider the cultural context of children and adolescents during treatment. Thank you so much.